I'm Dr. Janak Giridhar, working as a nephrologist at PRS Hospital, Trivandrum. Today, I'm here to discuss about a topic which is quite vexing for a lot of people, but more often than not a real source of worry. It is a topic about pedal edema. So, what is pedal edema? We'll be discussing today about pedal edema. What are the common causes of pedal edema? And how do we manage pedal edema on an OPD or an inpatient basis? So pedal edema is basically, quite simply speaking, it is just a swelling over your feet and ankles. Okay, so why does pedal edema occur? It is mainly due to a fluid accumulation that occurs over that aspect. Okay, or usually over our lower limbs. Okay, so swelling over our feet and ankles is what is known as pedal edema. So whenever we are discussing about pedal edema, we need to know that pedal edema can either be unilateral or bilateral. So there are implications for knowing whether it is unilateral or bilateral. Because the etiologies, or what we call causes for pedal edema, varies based on whether it is in a single limb or in both limbs. Unilateral means being present on a single limb, and bilateral means being present on both limbs. So we'll first discuss about the causes of unilateral pedal edema. So unilateral pedal edema, or swelling over one limb, over the ankle and feet, can usually be due to a local pathology. That is a pathology or some disease process which is usually confined to that particular lower limb. So that can be in cases of trauma, some trauma which has occurred over that particular area, or it can be due to an infection over that particular skin and soft tissue structures over that limb. Like that is what we call cellulitis. Or it can be due to a clot which is present over the deep veins of that particular lower limb. That is what we call deep venous thrombosis. Or it can be due to venous insufficiency. We have heard about varicose veins. So varicose veins also can cause this problem. Or it can be due to lymphatic insufficiency, as in lymphedema, what we hear like elephantiasis, filariasis. Those are all very rare instances. So these are all the usual causes of pedal edema over one single limb, or just right lower limb edema whenever we see. These may be the possible etiologies. But now when we are coming to the causes of bilateral lower limb edema, that is swelling present over both feet and both ankles, now the etiologies vary, the causes will vary. Usually when this happens, it can also once again be due to infections or deep venous thrombosis, all, but it is not that common. Usually all these issues occur over only one single limb, and rarely only over both lower limbs. So when do both lower limbs manifest with swelling or edema? Now, in the elderly population, it can commonly occur as a part of dependent pedal edema, or what we call the postal pedal edema. Now, that happens when you place your feet down and you sit for a prolonged period of time, especially in the elderly. Some patients can report some amount of pedal edema as a result of that. It can also occur in some obese individuals, markedly overweight individuals, or in patients who have hypothyroidism, or in certain physiological states like pregnancy itself can have some amount of pedal edema. Now, these are the not so worrisome causes of pedal edema, and these are the more common causes of pedal edema also. Now, what are the slightly more worrisome causes, and as a result of which not so common causes of pedal edema that we need to know as clinicians? So whenever we are seeing bilateral lower limb edema, which is significant, it can always be due to a possibility of a fluid overload. That is accumulation of fluid all over our body, which can also be seen in our lower limbs, which manifests as pedal edema. So this can happen as a result of heart failure due to heart problems, or as a result of kidney failure or due to kidney problems, or as a result of liver problems or liver cirrhosis. Now, any damage to any of these organs may manifest with this sort of a pedal edema as a part of a generalized fluid overload. That is, such patients can also have swelling over their arms, over their abdomen, can have water in their lungs as a result of which they can have breathing difficulty, can have puffiness over their face. All these things can happen in any of these organ problems. Okay. Now, that is one particular cause. Any sort of fluid overload which can cause the pedal edema. See, what we need to know is pedal edema, as we told, occurs as a result of fluid accumulation in our interstitial space. Now, see, we have got usually our vascular compartment within which blood is there and plasma is there. Whenever this plasma seeps out of the vascular compartment into the interstitial space, or the space outside the vessels, that is what manifests as the pedal edema. So this can happen as a result of increased hydrostatic pressure. that is increased fluid within the vessels, can lead to marked seepage of plasma outside the vessels. That is what we call increased hydrostatic pressure, which can happen as a result of any fluid overload states, which can happen in such heart problems, kidney problems, or liver problems. Now, this can also happen as a result of a reduced oncotic pressure, which is usually exerted by the presence of certain colloids within our blood vessels. In very simple terms, due to very reduced proteins within our vessels, this can lead to seepage of fluid outside if there are significantly reduced proteins within our vessels. So any cause of decreased proteins can also manifest with peel edema. So decreased proteins can be as a result of decreased intake, or it can be a result of increased protein loss actually. Now, increased protein loss can also once again be due to a urine loss or a GI tract loss, a gastrointestinal tract loss. Or it can be due to decreased synthesis or decreased production of proteins, as once again in liver problems like liver failure. So just broadly dividing these two things, whenever we are seeing a peel edema, usually which is happening over both lower limbs, the more vexing or the more serious etiologies that we need to be considering are usually the fluid overload states in which there is an increased hydrostatic pressure, which leads to a seepage of plasma from your blood vessels into the interstitial compartment, which manifests as swelling over your feet or ankle. Or this can be due to a result of decreased protein within our vessels, as a result of which fluid can come out. Decreased protein, always remember, can be due to a decreased nutritional intake or due to severe chronic inflammatory states, or which once again can cause reduced protein, like reduced albumin within our body. Or it can be due to increased loss from the urine or the GI tract, or it can be due to decreased synthesis as a result of liver problems. Now, these are the common causes of peel edema that we need to be knowing and which we need to evaluate depending on patient to patient. So it's not just based on the peel edema, but based on other symptoms and signs and other lab investigations that we decide whether we have to further pursue this or not, or whether we can reassure the patient and send them. Okay. Now, management. Coming to the management, what we need to know about the management is each patient varies actually. So do not go ahead and do these things unless you go and see a doctor and they assess you, and only after that should we take such steps actually. So usually we told about fluid overload. So fluid overload is when there is retention of salt and water inside the body. So if there is peel edema as a result of fluid overload, we can actually restrict the intake of salt and fluids within our body. In the same way, we are also given medicines called diuretics, which helps in excretion of salt and water from the body. So all these should be done only after consulting with a doctor and should not be done by yourself, as all these measures can lead to reduction in blood pressure and also can damage the kidneys if you do not do it appropriately. So it is extremely important that you follow the doctor's advice. Again and again, I'm saying that. Okay. Now, second thing. For patients who have problems like postal or dependent peel edema, certain other steps can help in alleviating this problem. Like keeping your lower limbs in an upright posture for 3 to 5 minutes a day, maybe separated over different time periods of the day, can help in reducing peel edema. In the same way, you can also wear compression stockings at times, especially in patients with varicose veins, chronic venous insufficiency, that is varicose veins itself. Compression stockings may also help in reducing peel edema to some extent. So these are the certain measures that we can use to alleviate or reduce peel edema. The other very important thing at the end, as a concluding statement, what I would like to say is peel edema by itself is not something very vexing, which can cause a lot of problems to patients. It is often a source of anxiety for most patients. And what I would like to say is you need not worry about peel edema much. All we need to know is whether peel edema is a manifestation of some other systemic disease, which usually if you see a doctor, they can properly evaluate and reassure you whether it is or it is not. And by itself, peel edema alone, isolated peel edema usually does not cause much problems. Okay, thank you.